Our plan for the month ahead with this briefings, next week's briefing will cover and focus on staff concerns. We recognize that we often talk about students and faculty, but we want to talk about issues of particular significance to staff. We've been working on a number of fronts, and we'll have more information to share next Friday. Also, there won't be a weekly briefing the day after Thanksgiving, the following week, as all hopefully we'll be celebrating and resting a bit for the holidays. Today's agenda, we'll hear from Chief Health Officer Preeti Malani as usual, who will give an update on campus conditions. Provost Collins and Vice President Harmon will provide updates from academic affairs and from student life. We're joined today by a special guest, Executive Vice President and Dean of the Medical School, Marshall Runge, who'll discuss the COVID-19 outlook for hospitals nationwide and for Michigan Medicine, as well as provide us with an update on vaccine trials and new treatments for COVID-19. I'm also grateful we're joined once again by Jimena Lovelock, Washtenaw County's health officer, and she'll provide an update on what's happening locally with the status of the pandemic and our response. Before we get started, I'd like to once again apologize to students and their families for the disruption that has occurred because of our announcement last week about less housing being available for the winter semester. It's critical to lower the density of students in housing and to switch to all single rooms to do our part to decrease the spread of COVID-19. We certainly realize how difficult this is for many, and we're going to try our very best to work with everybody to mitigate the consequences. You'll hear a little bit more about that from the provost and from Vice President Harmon a little bit later. I need to remind students that we have many open appointment times remaining for departure testing. It is truly important that everyone in the residence halls and all other students who will be traveling home for the holidays get a COVID-19 test within a few days of leaving town. It's incredibly important not to bring an infection home to your family, people who may be at higher risk than yourselves. Please also limit your contacts for the week before you go home. Be very extra vigilant this week. The test is a point in time. It tells you whether you have a certain amount of detectable virus on a certain day. It doesn't mean that 2 days later you won't be infected, or that 2 days earlier you actually were infected, but it just hadn't built up to a high enough level yet. So everyone's going to have to make a contribution across the holidays to enjoy some time off, but keep yourself and your family safe. I'd first like to turn things over to Dr. Preeti Malani. Preeti?
Yeah, thank you. So the in-person portion of the semester is coming to a close, and by and large, things are better on campus, although we continue to see a steady trickle of new cases, including a cluster that was identified at South Quad this past week. Unfortunately, case counts are surging all over the nation, and I'm sure people are seeing this in terms of the various trackers across the country, and test positivity in the state of Michigan has climbed to over 12%, and we had been well below 3% for weeks and weeks on end. And these numbers are not sustainable. And our hospital is seeing large increases in patients with COVID infection, and some hospitals all over the state are really approaching capacity, and we're worried about running out of life-saving personal protective equipment. And even saying that makes my heart pound. And I know we'll hear more from Dr. Runge in a few minutes on sort of the state of our hospital as well as our state. I did want to give a shout out to healthcare workers across our state, especially my brothers and sisters at Michigan Medicine, including my actual brother, who is an infectious disease doctor locally. I know that you are physically and emotionally exhausted. Thank you to the entire team, every single person, for your continued professionalism, your compassion, your selflessness. And to everyone else, the applause and chalk drawings and food, they're wonderful gestures. But what we really need you to do is stop the spread of COVID. Once again, I want to emphasize the absolute need to be vigilant. This cannot be business as usual. We need to eliminate gatherings, spread out, wear a mask, stay home if you're sick. We're at a really dangerous inflection point, and this is really concerning to me. What we've seen in the last few weeks is alarming. The situation cannot turn around without everyone's cooperation, and I know we're going to hear a little more from our colleague Jimena from Washtenaw County Health Department. Sort of pivoting back to students and sort of reiterating some of the comments the president made, The students who are leaving the residence halls are required to complete departure testing. Off-campus students are also encouraged to get tested, and the full details are on the U of M COVID website. Students, if you haven't been tested, the best way to get tested this weekend is at the IM building. It's a beautiful venue. It's a historic space. There's plenty of capacity, and please don't wait till the last minute. I know everyone is busy, but sign up now. In the meantime, all students are expected to practice enhanced social distancing for your remaining time on campus. And the State Department of Health and Human Services put forth some nice guidance yesterday emphasizing this. Other states are starting to do this as well. And we'll put a link to those materials in the president's email later today. Getting tested before leaving campus can help reduce the likelihood of bringing COVID to your home community. But remember, and again, I just want to say it once again, a negative test represents a moment in time. It is not a guarantee. It's rather one of several things that you can do to get home safely. After getting home, students should quarantine for 14 days. And of course, travel safely and continue to be safe once you are home. The holidays are always special, and it's a time that we like to gather with friends and our extended families. And if this year, for most of us, it's going to be different. And for many families, it's going to also be very difficult. But each of us needs to make decisions on how to celebrate safely. The uninvited guest this year is COVID. And unfortunately, small household gatherings are an important contributor to the current surge in COVID-19 cases, including in our state. In general, limit the holiday gatherings to those within your household. If you are meeting with others, keep the group small and make sure everyone is following guidance carefully. Have those conversations ahead of time and be honest. The lives of the people that you love depend on it. Ensure that people wear their mask properly, maintain a distance of 6 feet. If possible, gather outside, use your garage, keep the windows open to improve ventilation. And, frankly, I think it's sometimes nice to just enjoy each other's company and eat and drink on your own. A lot of us have learned to use technology to connect safely with friends and family. So think about ways to support loved ones that are on their own, especially older adults who may be experiencing isolation and loneliness. And this is really hard for families who are separated. If you are working in person like I am, be vigilant about the public health guidelines. This is true at our health system where we're often crowded together. It's just the way it is. There can't be office potlucks this year. We have to find safe alternatives to celebrate. The theme this holiday season is really the same as it's been all year. Reframe, connect, and celebrate, but do so safely.
Thanks, Dr. Malani. Provost Collins?
Yes, thank you very much. In my remarks today, I'd like to touch on 3 different topics. One will be grading, also course evaluations, and supporting our student learning in this very stressful environment. So first of all, earlier today, we announced a decision to provide undergraduate students on the Ann Arbor campus with the option to convert A, B, or C grades to a pass. This change was made in consultation with the deans of the schools and colleges, and it will apply for both the current semester, fall 2020, and also the winter 2021 semester. The intent here is to support and provide some additional flexibility for our students who may be facing significant challenges academically and perhaps personally due to circumstances that really are beyond their control. I'll briefly describe the change and how it builds on the previous modifications and also the rationale. So we announced 2 changes for the academic year back in August, and both of those remain in effect. One is the more flexible late drop date policy that allows students to withdraw from a course at any time up until the end of classes without having the course appear on their official transcript. And again, that remains in effect. We also began the fall with a system that automatically converts all D and E grades to an NRC, which stands for No Record COVID, with the option to convert that NRC to a letter grade if requested, and that also remains in effect. However, the challenges have been more extensive than envisioned for many students, and also with more profound impacts on some of our most vulnerable students. Many students and parents, as well as the CSG, have raised concerns. So to promote equity and student well-being, all undergraduate students will now be able to choose to convert an A, B, or C grade to a pass. And this system allows students to continue to progress towards graduation with a safety net for GPAs to not be negatively affected by circumstances and to enable them to do their best work this academic year. This can help students to focus on their studies more effectively, and that is certainly one of the key goals. I do want to note that we are not changing academic policy. In particular, the minimum grade for courses to meet a program requirement will remain unchanged. I'd like to stress that students are strongly advised to discuss with their advisors the possible implications of a decision to convert their grade to a pass. These implications could include impacts on financial aid, on progress towards degree, and on issues related to applying for graduate programs in the future. So students are really strongly encouraged to use caution as they consider this new option. We've provided ample time until July 1 for fall classes and November 1 for winter classes to really encourage you to talk things through before making a decision. In addition, the Rackham Graduate School is also adopting additional modifications to grading that build on the modifications that were announced back in August. These changes will provide Rackham graduate students with a one-time option to change any or all of their letter grades of A+ to B- to an S for satisfactory. Grading policies for non-Rackham graduate and professional programs will be determined and communicated individually by the schools and colleges. My second topic, last weekend, I emailed the deans of all of the schools and colleges with a message intended for all faculty who are teaching this semester. Specifically, I strongly encouraged instructors to consider students' well-being and the impact of stress on learning while maintaining the commitments, of course, to academic excellence. And some of the examples, there may be ways to relax non-essential work without compromising academic integrity. Maybe some assignments are not must-do or could actually be completed during class time instead of being assigned as additional work for students outside of class. Instructors might actually reach out to students in their classes and ask whether there are particular approaches that might help the students to manage stress and really focus on their learning. And in some cases, flexibility with due dates for assignments may be appropriate. I do want to note, though, that pushing back assignment dates, given all the compounded delays of this semester, could cause other challenges. And so, again, students and their instructors should be clear about those implications before having a deadline extended. This really has been a tumultuous term for the university and really difficult for many faculty, if not most, as well as for our students. And as these final weeks progress, they'll pose some additional challenges as many students return to their permanent residences while they're completing their courses. So working together to find ways to improve the academic experience going forward really will be a priority for me and the Provost's office team and our academic leaders in the weeks and months ahead. It's something that we can work on together and something that we look forward to moving forward on. Finally, we've added a few additional questions to the course evaluations that focus on the current context. The deans have also agreed to use the current course evaluations in teaching personnel considerations, such as annual review and promotion and tenure reviews, taking appropriate care. So in particular, applying the following principles. Academic units should be mindful and explicit about the context of the term, recognizing and considering the pandemic's effects overall, but also on individual instructors' teaching situations. For instance, faculty have had to spend considerably more time teaching this term. Faculty care has disproportionately impacted our women faculty, and service demands on many faculty of color have increased as we have explored ways to implement anti-racist policies and practices. As always, but really especially now, evaluation of teaching should be based on multiple indicators and not just on student course evaluations. Other indicators include peer review of syllabi, peer observations of teaching, and the instructor's teaching statement, to mention a few. And finally, while teaching innovations are really more important than ever right now, we also need to recognize that innovations are going to have varied results. And even those that may need improvement over time can still be really valuable for the long-term learning and knowledge development in terms of how we teach effectively. So all of those are considerations that need to be brought to bear as we think about using course evaluations in assessing our instructors. So I will stop there. Thank you very much.
Thanks, Susan. Vice President Harmon.
Thank you, President Schlissel, and good afternoon, everyone. With classes, the election, the rising number of COVID cases, winter term plans, and the approach of Thanksgiving, there's a lot on everyone's mind. I know the timing of all of this has been exceptionally challenging for our students and our families. Also recognize that our first year students and those who are from out of state and around the world are particularly affected by our shared effort to reduce the number of students on and near campus for the winter semester based on public health guidance. I apologize for the impact of these changes. With all of the recent updates, I want to take a few minutes today to review a few key points about winter 2021. First of all, as you will hear throughout this program, public health experts are warning that the local COVID-19 infection rate is increasing and that the onset of colder weather introduces a significant risk to the virus spread. We remain concerned about the capacity of local and campus resources to provide appropriate support and a response for the population of undergraduate students in housing should the infection rate continue to increase. And we're also concerned about flu season. We encourage students to get flu shots. We know that this has not been a normal undergraduate college experience this year, and we know that it's going to continue to not be normal. That's hard and disproportionately difficult for our first year students. There's a very real concern at the forefront of our planning that limitations on social gatherings during winter will only exacerbate the challenges that continue around student isolation this fall semester. For some of our undergrads, while not coming back to campus next semester may be disappointing, along with many other experiences that are affected by the pandemic, the benefits of completing classes at home with the support and care of family may outweigh those factors. For students whose circumstances inform their need to return to our physical campus in winter 21, whether you're in Michigan housing or off campus in Ann Arbor, please remember you're committing to a shared responsibility. You're committing to keeping our community, including yourselves, safe and following the rules and guidelines. The behavior enforcement and accountability expectations will be high. And while I believe you can all rise to the occasion, I don't want you to underestimate the challenge associated with this shifting landscape. Today, I also want to remind our students and other listeners of the timing of future actions and logistics around the Residence Hall move. We plan to reply to all the requests for winter 21 housing by Monday, November 16th. While we may not have your winter 21 room and building determined yet, we will be able to confirm that you have a space. We also know that you'll also figure out your move out plans. While we're working to be as flexible as possible with sign up time slots to move out through November 22nd, as well as the ability to retrieve your belongings even later if needed, between November 30th and December 6th of 2020. If you need more time, we will make that available. You also may need helpers to join you, and that's totally fine. We'll have packing boxes and tape ready for you. You and all of your helpers will need to wear face coverings and observe social distancing. We also encourage guests to complete the Responsive Blue health screening app. You can also call John's Pack and Ship, a local company, and they will pack, ship, or store your belongings for a fee. As we ramp up safe spaces and virtual engagement in the winter term, I want to share some information with you. Student Life will sustain and increase the delivery of a full portfolio of co-curricular educational programs and support offerings provided during the fall and in a virtual format. So we will continue that and increase that in the winter. Virtual programs and support will be available to students no matter where you reside during winter term. Some examples include peer support groups via the Wolverine Support Network, individual and group wellness coaching sessions through Wolverine Wellness, intramural sports leagues, small scale, in-person and at home competitions, and esports offered through Rec Sports. The Community Matters cohort program, which matches a pair of upper class facilitators with a small group of first-year students to build community, lasting friendships, and a sense of belonging at the University of Michigan. More resources are available if you search studentlife.umish.edu/find#community. And then finally, we really want you to stay safe during the home stretch this final weekend. I know that we're in the home stretch, but we're keeping in mind our culture of care. It extends beyond taking care of the maize and blue to your families and friends at home. Remember, your choices this weekend will also affect your family and the communities that you'll be returning to. But that doesn't mean you can't have fun. You can still watch and enjoy a Wolverines victory safely in pods or with roommates. So let's finish safe and strong and keep your family safe too. Thank you very much, and go Blue.
Thanks, Martino. Next, Jimena Lovelock. Jimena.
Thank you so much, President Schlissel. I'm happy to be with all of you again this afternoon. Again, my name is Jimena Lovelock. I'm the health officer with the Washtenaw County Health Department. The Washtenaw County Health Department promotes the health and works to prevent disease and injury in our community. The health department has the authority and responsibility to protect public health, including responding to disease outbreaks. This responsibility has been put to the test more than ever before as we continue to lead the COVID-19 response in our county more than 8 months since our first confirmed case. COVID-19 cases and hospitalizations are growing exponentially in Washtenaw County and across Michigan. This marked increase in cases is straining our public health capacity to such an extent that just yesterday we had to communicate to our residents that case investigation and contact tracing calls and emails from the health department are likely to be delayed. Whether you are a faculty member, staff, or a student at the University of Michigan, this impacts you as our staff works day in and day out to protect public health throughout our county. Washtenaw County has reported a total of 7,303 confirmed and probable cases of COVID-19 as of yesterday. A total of 159 new confirmed cases were reported to the health department in the past 24 hours. And for the first time since this past spring, we have had over 25 hospitalizations in Washtenaw County residents in a week. The average number of new cases per day was 97 for the past week, compared to 35 per day during the second week of October, and even less, 17 cases per day in the last week of August. Now we are seeing significant community spread and increasing cases across the county. We are continually monitoring, adjusting our priorities, and working to expand our capacity as much as possible. We must also rely on strong partnerships and the cooperation of community members to follow public health guidelines. When COVID-19 cases started to increase in mid-October among undergraduate students at U of M and strain public health capacity, there was a coordinated response and recognition that additional restrictions needed to be put in place. After the health department's stay-in-place order expired on November 3rd, cases among U of M undergraduate students went from representing more than 60% of cases in Washtenaw County to about a quarter of cases currently. While those metrics have improved and we appreciate those who cooperated with a stay-in-place order, we have also received numerous complaints related to violations of local orders as well as state epidemic orders limiting indoor gatherings to no more than 10 people in a residential setting. With the recent approval of the Washtenaw County Board of Commissioners, the Health Department has the authority to issue civil monetary penalties for violations of local public health orders. In collaboration with U of M and the City of Ann Arbor, we are currently investigating these complaints and are prepared to issue penalties for documented violations. Unfortunately, the exponential growth in cases in our county and the extensive community spread are exactly what we feared would happen as winter approaches. Given our concerns about the coming months and our experience during the fall, we support the university's altered plans for the winter semester. We encourage all students who can continue their studies remotely to stay home at their permanent residence and not return to campus for the winter. In the remaining weeks of the fall semester, I want to emphasize the importance of critically evaluating all situations for risk and avoiding the 4 C's: crowded spaces, close contact, closed spaces, and cheering or loud talking. To reduce the spread of illness, the health department recommends wearing a face covering, maintaining 6 feet of distance from others not in your household, cleaning hands frequently, and avoiding others if you have any symptoms. These prevention strategies are most effective when combined. As you prepare to go home for Thanksgiving, think about how to protect your family, friends, and community from illness. Students traveling across Michigan or to other states to visit friends and family over the holidays risk bringing COVID-19 home with them, fueling outbreaks within their households and communities, and reintroducing COVID-19 to campuses if they return. We encourage students to follow the U of M departure testing protocol, and before returning home, focus on doing only essential activities with COVID precautions and continue to follow prevention strategies when you are with your family. That means wearing a mask at all times around people you are not living with on campus, maintaining 6 feet of distance from others, and not attending gatherings outside the home, including meeting up with your high school friends who may be in town. For everyone, please consider these factors that contribute to the risk of getting infected or infecting others with COVID-19 at a holiday celebration. Think about community levels of COVID-19. If there's community spread, refrain from hosting or attending a holiday gathering. Consider a virtual gathering instead. Think about the location of the gathering. Indoor gatherings generally pose more risk than outdoor gatherings. Indoor gatherings with poor ventilation pose more risk than those with good ventilation, such as those with open windows and doors. Think about the duration of the gathering. Longer gatherings pose more risk than shorter gatherings. What about the number of the people at the gathering? Gatherings with more people pose more risk than gatherings with less people. In Michigan, indoor residential gatherings can be no more than 10 people. The behavior of attendees before the gathering is important. Have attendees been adhering to maintaining physical distance, mask wearing, hand washing? And the behavior of attendees during the gathering is equally important. Gatherings with preventive measures in place, such as mask wearing, social distancing, hand washing, pose less risk than gatherings where few or no preventive measures are followed. We recognize the many challenges that COVID-19 has created for students, workers, and families. Please don't let complacency get the better of you, and don't let your guard down. Our health department staff are exhausted, but they are the most dedicated group of public health professionals I know, and we will continue to do everything in our power to protect the health of our residents, whether or not Washtenaw County is your permanent home. On behalf of the Washtenaw County Health Department, I extend our thanks to U of M for their strong partnership, and to all of you for doing your part to stay healthy and safe. Thank you.
Thanks very much, Jimena. And I say thank you back to our friends and collaborators at the Health Department. The partnership has really been outstanding, and I am certain that you've helped us improve health across our campus in this really unusual time. And we all recognize the seriousness of your responsibility and the workload. And so we appreciate your time today as well. I next turn to Dr. Runge.
Thank you, President Schlissel. I'll be repeating some themes that you've heard in a slightly different way, and I think we're all saying exactly the same thing. COVID-19 infections and hospitalizations are rising rapidly across the United States, and we're seeing exactly the same thing here at Michigan Medicine Hospitals. Over the last several weeks, the number of inpatient COVID positive individuals has increased at a doubling rate of every 2 weeks. In the initial wave of COVID-19 in the spring and early summer, after the initial wave, in early summer and fall, our average daily census for hospitalized COVID-19 positive patients stabilized at about 10 per day over a period of about 2 months. Yesterday, we had a total of 62 hospitalized COVID patients, including adults and children, with 15 of whom are critically ill and requiring ICU care. We've increased our COVID testing a great deal over the past 2 months, which has allowed some further clarification of just how much COVID-19 we have in our community. It hasn't been assessed comprehensively, but 2 months ago, the percent of those who tested positive was less than 5%. Based on our recent results, that's increased to 12%. It is important to know that the positive test rates in asymptomatic individuals is lower by at least tenfold. The message here is that there's far more COVID-19 in our community than there was in late summer and early fall, and we know how to control this. Vigilance using face masks, practicing social distancing and hand hygiene. This works, and we have some very strong evidence to support this statement, which I'll tell you about right now. COVID positive rates from the first wave were less in our healthcare workers than in the community. So in a high-risk environment. In a CDC study, the rate for about 3,000 of our frontline health care providers, those in the emergency room, the intensive care units, and operating and procedural settings was 1.4%. At the same time, the rate of infection locally was about 3%, and outside of our local area, but close by, was as high as 7%. Our rates continue to be low, and all evidence actually pointed to the vast majority of infections of healthcare workers were not patient to healthcare worker transmissions. They were from the community. Well, how could this have been? We rigorously required protective approaches, those same approaches I just said above. And if you do that in a healthcare setting, this can provide safety for you. So we know it can provide safety, as you've just heard, in your friends, families, communities. With regard to those hospitalized, the good news is we're able to better treat COVID-19 today than last March. There have been a lot of advances, and most recently, there are vaccines and new therapies. So why did we get to where we are? I think there are lots of reasons, but part of it is everyone's stressed, everyone's fatigued. We're tired of living this way, tired of social isolation and not being able to pursue our favorite pastimes. And the more COVID there is in the community, the faster it spreads. Most recently, with the likelihood the vaccines will be available in the near future, it will be even more likely that people could relax and not be as vigilant as we were before. So I will just underscore yet again the importance of using all the approaches that have been described by those speaking previously to me. I'll tell you about a couple of optimistic developments. In addition to COVID testing capacity and knowledge from the last wave of therapies, two major pharmaceutical companies have developed the first COVID-specific therapy using monoclonal antibodies to inhibit COVID-19 from being produced by cells in the body. When this is done early in the infection, particularly within 4 to 5 days after symptoms, there is a dramatic reduction of hospitalization by 75% in high-risk individuals. And as you know, a number of high-profile individuals across the United States have received one or the other of these two antibody therapies. While studies are not complete, these are extremely positive. Now, in terms of vaccines, they look also extremely positive, although studies aren't completed they seem to have very high efficiency and safety. And it is likely that within the coming month or two, these vaccines will become available. As these come available, there's at least one and possibly a second. There are more vaccines that are close to in the late stages of development, and Michigan Medicine is very involved in these. Dr. Nujira Lugogo is our principal investigator for Janssen's phase 3 clinical trial to study a COVID-19 vaccine candidate. This trial is known as Ensemble. It'll recruit up to 60,000 adult participants of all gender, racial, and ethnic groups around the world. We're also partnering with AstraZeneca on a phase 3 COVID-19 vaccine study that will enroll 30,000 patients with the same representative mix of gender, ethnicity, and other factors representative of the population in the United States. And there are at least 5 others that are far along in testing. Well, even with this wonderful news, which it is great news, and I think we will do better in terms of hospitalization and mortality, it's simply not possible for us to immunize everyone right away. It may take a year or more before enough of us are immunized to provide what you've heard called herd immunity. So keep doing what you're doing. Keep vigilant. Things will get better. I'm happy to answer any questions later in the hour, and we'll also be happy to provide FAQs on questions of interest in the coming week. Let me just close by saying that we introduced a little bit of uncertainty about the availability of the on-campus tests, and that is being clarified now. Thank you very much.
Thank you, Marshall. Preeti, can I call upon you to help us organize ourselves and answer some questions?
Yeah, absolutely. Marshall, there's a question about visitor policy, and as things are surging and number of patients are increasing, can you comment on where that's going and if there's any information?
Yes. So we made a huge effort in the spring to limit visitors, and it's the same theory that the fewer people in an area, the less chance of infection. We made some changes in our current policies. So as of this time, no visitors are allowed with ED, adult emergency department patients, except when medically necessary. That takes visitors out of the waiting room. And in addition, we're going to be more very vigilant about the number of visitors in the hospital. Only each adult or adult patient in any of our facilities may only have one visitor, and children and pediatric patients can have 2. Importantly, family and visitors are required to wear their mask, covering their mouth and nose at all times when at Michigan Medicine. This includes within a patient room and throughout the facility. We believe that this will dramatically reduce the chance of infection in the hospital setting.
Thank you. Next question is for Martino. If a student meets criteria and is provided with housing for winter of 2021, will they be charged the higher single occupancy rates, even though single occupancy is the only option available?
No, absolutely not. They will be charged the double occupancy rate, although they will be in a single occupancy room. And if for some reason their room in the fall was lower than the double occupancy rate, then we will adjust that to make sure that they have the same rate that they had before. But no, they will be charged the double occupancy rate.
Thank you so much. Just a kind of related question, Martino, will study spaces be available in the winter semester? I don't know if you or Susan want to weigh in on that.
Well, I can talk about it in the residence halls, and perhaps Susan can cover other areas. So within the residence halls, the lounges and the community spaces will be open by reservation only. That allows us to limit the number of people in the space at the same time. And obviously, social distancing and mask wearing will be required. And this is a change from this current semester where those spaces were not open, but it'll be by reservation only. So I'll turn it over to Susan to speak to the rest.
Great. So just to follow up on that, the answer for the other academic spaces is also yes. What we will do is continue to offer study space access on campus in the same way that we're doing at the moment. So the answer is yes. I'd actually like, if I may, to just to follow up on some comments and questions that I'm seeing in the Q&A that are coming from some of our advising staff who absolutely are essential to supporting our students by providing information and helping them to make thoughtful decisions for their academic progress, which is, as I said, is essential. And I just like to apologize for the fact that as we were pulling all of these things together and making decisions, that we were not sure to get all of the information out in a kind of timely way before the announcement to our advising staff. If there are any questions that have not been clarified at this stage, please email us at the provost at umich.edu, and we will get back to you promptly to respond to any questions about the new grading changes that we have put in place to make sure that you can really, continue to do such a great job. Thank you for doing that.
Thanks for answering that question too. Jimena, I want to ask you a question that came up, and this question says, people I want to meet up with for Thanksgiving have already had COVID within the last month, but I haven't had it. Is it safe to gather with them?
Well, I would say, again, if that person is not a person in your household, we would want to make sure that if you do gather with them, that you continue to use the precautions that we've talked about. I'll leave it to the medical experts to talk a little bit more about what we're finding out in terms of reinfection. But of course, the challenge is that you want to keep yourself safe and protect everyone around you from COVID-19.
Yeah, I would just add, it's complicated in terms of what you hear from people, and especially if they're not within your household. And really the recommendation remains like, wear your mask, keep your distance. And I know that there's this tendency to think, and reinfection fortunately appears to be rare, but it isn't a reason to not have any mitigation. And that question probably is going to come up for some families. So thank you for responding. This is another one for Susan. Many first-year courses have a policy stating the lack of internet connection is not an excuse for turning in homework late. For the upcoming winter semester, will the University of Michigan implement any policy to help these students disproportionately affected by internet connection policies in many first-year classes? And this is, again, a concern with access to internet might result in no credit for particular assignments.
So internet access is clearly essential for coursework in the current context. And so I'd really like to make a number of suggestions to help students who might have concerns about this issue and appreciate having it be raised. First, any first-year student who anticipates a persistent or repeated problem related to internet access should really consider applying to remain in campus housing. This is one of the very important examples of why we're making that residence hall space available to students who need it. In addition, all students should really plan for the possibility that there could be an internet outage and not wait until the last minute to submit assignments. If you set your own deadline a few hours, a bit in advance of when the real one is, you can actually provide yourself with some more options in order to address that kind of challenge. In particular, for examples like Engineering 101, there's an open window of at least 48 hours to submit each assignment, and taking advantage of that can be really prudent in this context. We'll also continue to encourage instructors to design courses that accommodate occasional problems with access, which we certainly know can arise. For example, by dropping the lowest or a couple of the lowest homework scores from the final grades to give a little bit of flexibility there. We also strongly encourage students to be in touch with instructors proactively. That can be helpful as well. In addition, ITS has put together a very helpful remote resource guide that includes lots of advice about how to improve home internet, including how to find free or low-cost providers in different areas, including in Ann Arbor, but also beyond the Ann Arbor area. That resource guide is available on the ITS website. If you, in the U of M website, the main one, if you enter improve your home internet, it'll pop up and you can find it easily that way. So again, those are a number of options for addressing something that I know is certainly of concern in a time when internet access is really important for our coursework.
Thanks for those great suggestions. And it goes beyond students. I think all of us are struggling with internet at home. I know we had to upgrade our internet with all the folks using it. This is a question for Jimena and Martino. What steps will the university take to ensure students off campus are abiding by appropriate COVID protocols? And I think this question becomes more relevant as the residence halls de-densify and some people are coming back and maybe living off campus. Maybe start with Martino.
Sure. So we will continue our efforts from the fall and in many ways sharpen them and improve them For example, we had the COVID concerns line, which is a phone line that residents in the neighborhoods or other students can call to report a concern about COVID safety practices. If you see people, groups of people that are not distancing, that are gathering above the gathering limits. So when you call that line, it goes to a staff person or staff people rather in the EOC, the Emergency Operations Center, and then they will communicate and either reach out to that particular residence if we have the phone number, the contact information, or they will send a member of UMPD out to really remind the student about the gathering limits or the issue. And if need be, they will disperse that particular gathering. And of course, some individuals may contact the Ann Arbor Police Department, and the UMPD and Ann Arbor PD will coordinate. In addition to that, we have established accountability measures by creating an addendum to the Statement of Student Rights and Responsibilities that's all focused on COVID safety. And that allows us to, once we have names of individuals, that allows us to address concerns within the framework of conduct. One of the things that we will change for this winter semester is we may likely do parental notifications if warranted. We may even do an interim emergency suspension if needed, depending on the nature of the particular offense. And then finally, during high-risk weekends, such as Halloween and the University of Michigan, Michigan State game, we have staff from the Student Life Division that are out and about, really just observing and reminding students, about the important safety protocols. So we have a number of initiatives to help. We know we can't see everything, so I would encourage people, if you have a concern, to call the COVID concerns line.
Thanks. Himina, do you want to add anything to that? And we really appreciate your partnership. You guys have been superheroes throughout this, but the partnership, especially with the campus things, have been amazing. But I don't know if you have anything to add.
Sure. I think Martino covered obviously very important points. I would just add from the health department's perspective, we've really worked on strengthening our partnership with U of M and with the city of Ann Arbor around this issue in particular. I think we are at a point where we have been able to share information effectively and really talk about some coordinated strategies and response. As I mentioned in my remarks, the county now does have civil monetary penalties that can be levied against individuals that maybe are violating public health orders. And so that's something that we hope we don't have to resort to very often, but it is there. And in addition, I think we have to continue, as we look to the winter semester, to continue to be vigilant and really continue that coordination and information sharing with all of the partners, whether it's the city of Ann Arbor, whether it's U of M, the health department as well. People can always contact the health department if they have particular concerns. Of course, we're not a 24-hour operation, but we do respond to every complaint or concern that we get as capacity allows.
I'd like to add one thing, Preeti, if it's okay, about students who are leaving the residence halls. And we encourage you to spend the winter semester studying from your permanent residence from home. That's certainly the lowest density situation to be in. But I recognize that there are students, I've heard, who are already seeking or have found rental places in town. If you're living in town, if you're living in a one-bedroom apartment or with one roommate and a bathroom, you can live very safely. Just be careful, be smart, continue to follow the guidelines. Don't have large groups of people in small spaces. Wear your mask, even though you're not in your dormitory, but when you're out of your apartment, continue to follow this kind of guidance, and also continue to look towards the University Health Service for your medical care. If you have symptoms, have a very low threshold for calling UHS, and you'll get tested. And that's the quickest way to get good follow-up, good ongoing care, and prevent the spread of the illness. So although we encourage people to study from their permanent home, those of you that don't, you still have to be vigilant for your own sake and for the sake of the wider community.
Thank you for for restating that. And, Marshall, there's a question that I'm going to pose to you. Can you please clarify the testing options for people who are at Michigan Medicine who want testing due to concern about possible high-risk exposure?
The initial answer is if you have had a high-risk exposure, the first approach is to contact occupational health, and based on that recommendation or decision will be made about testing. Currently, we don't have available sufficient on-request testing. The surveillance testing that's being done is through the route that currently exists. This is all under evaluation and thinking about, but we don't have all the knowns. But for a high-risk exposure, typically OHS would recommend testing.
And I'll just add that anyone with symptoms or high-risk exposure, OHS is the place. They are backed up this week. There's been a lot of activity, and so the phones are taking longer than it should, but they will get to you. And again, follow that guidance, especially at Michigan Medicine. And then again, stay tuned for surveillance testing, and that'll be coming too. Right now, everything's focused on the departure testing for students. Susan, question for you about any additional, is there any additional guidance or information that can be shared with international students? And there's been a lot of change in the last week that's been announced, and how does that affect it? And how are we supporting the international students?
Yeah, so I'm happy to provide some more information about that. And we do recognize that for international students for whom the winter semester will be their first semester in the United States, that under the current policies, there's some additional considerations for those students and complications. So again, under the current regulations, those students, again, the students for whom the winter semester will be their first in the United States, those students must have at least one in-person or hybrid class in order to maintain lawful immigration status. So for those students, our schools and colleges will absolutely work with you to help you identify an appropriate class to be sure to satisfy that requirement. And so I encourage any students in that category to contact their academic departments, and we will certainly be supportive and work with you as we continue to monitor whether these regulations are adjusted in the months ahead.
Thanks. And this is a pretty specific question here, and I think this one I understand President Schlissel has an answer to this. I've been a custodian here for 13 years. When the virus first started, we were instructed to start using a Spartan chemical for disinfection. Now we have run out of it, and we were told to go back to the chemical that we used before this all started. Why are we going back to that product, especially now that the pandemic is spiking?
We actually got this question in advance, so I had our staff look up the correct answer. But from our facilities and operations group, we switched our disinfectant to a Spartan product because at the time, the product we used was not on EPA's list of approved chemicals for use against COVID-19. However, after a few months, the original chemical was added to the list of approved chemicals for use on COVID-19 to get rid of COVID-19. So we just went back to the original one. So the one that's in use now is approved for disinfecting surfaces from live virus. So that's good.
I wanted to add one more thing, going back to the provost's response to the international students. It was highlighted to me that to keep in mind that the international students can apply for housing, especially the ones who are new to campus. Some of them are going to be here. Some of them are graduate students, but remember, we keep in mind that they don't have an easy way to get back to their permanent residence. And this has been something that's actually been in place for years because they normally wouldn't leave at the semester break anyway. And so there's a team that's been supporting the international students extra care this year because it's been quite tumultuous. So with that, I'm going to hand it back to President Schlissel.
Thanks very much, Dr. Milani. So, the good news that we heard within the last week, and I'm still waiting to see the data, is the surprisingly strong effectiveness of a vaccine that's being developed and then distributed eventually by Pfizer. And, Pfizer, their manufacturing plant for this vaccine is actually in Western Michigan. So it'll be a made in Michigan vaccine. And that's, an extreme cause of optimism. I don't want to give false optimism in that it's going to take a while logistically to distribute this vaccine to enough people in our population to allow us to get back to a normal lifestyle. But a year ago or 9 months ago, we didn't know if a vaccine against COVID-19 was even possible. So now I think there's very strong evidence. It's not the only vaccine. There are others that are in the works. So we'll be getting more news pretty soon. These companies are going to ramp up as quickly as they can. We're going to look hard at the safety data. The Food and Drug Administration will look very carefully, and outside advisors will look very carefully. But once that vaccine's approved, it'll be distributed according to rules set up by the federal government, I'm guessing, and then ultimately available to all of us. And at those times, we'll encourage everyone to get vaccinated. I'm almost certain it'll be free, and the university will do everything that it can to make sure that all of the people associated with the university, our students, our faculty and staff, have access to the vaccine, and we can get it to them in an organized and safe way. So that's the good news. Because there's a vaccine, we can now see the horizon. We can see that this may end. And because we can see a horizon, I think it makes it even more important for each of us to take personal responsibility to keep us and our families and friends and neighbors as safe as possible. Anyone who dies now from COVID-19, if it was a year from now and there was a vaccine, they wouldn't be dying from COVID-19. So our diminishing the spread of this illness now will see us through to a time where it's a historically interesting subject, but it's no longer an everyday threat. So it's on all of us to do everything we can to make it through to the other side, where the most outstanding advance in the history of medicine, vaccination, actually can protect and hopefully even eliminate this disease. Until then, is mask, distancing, hand washing, just being smart. We know that works. It's hard, but now that we can see a horizon, I think all of us should double down on our commitment to keep one another and our families safe. So thank you all very much. Next week, we're going to focus many of our comments on staff and issues relating to staff. Please, students, get your exit testing, do your exit protocols, do your social distancing this week, finish strong, have a great holiday break, and everybody stay safe and go blue. Thank you all.